your health history today. Alright, let's see. Do you have any allergies to aspirin?
No.
Any allergies to codeine?
No.
Any allergies to latex?
Nope.
Any bad reactions with local anesthetic in the past?
No.
No bad reactions to penicillin? And no sulfa allergies?
Nope.
Awesome. Have you had any history of abnormal or like high or low blood pressure?
Nope.
Any history of HIV or AIDS?
Nope.
Awesome. Any history of anemia or any blood conditions?
Not that I know of.
Awesome. No artificial heart valves? Awesome. And you don't have any blood disease?
Nope.
No congenital heart conditions? Heart problems at all? And no pacemaker?
No.
Any history of arthritis or rheumatoid arthritis or gout? No artificial joints or bones? And no asthma or anything? No history of cancer or chemotherapy? Any history of diabetes? How about emphysema or glaucoma? Any radiation treatment you've ever had in the past? Any shortness of breath or breathing problems? No sinus problems in the past?
Nope.
No history of strokes?
Nope.
Thyroid problems?
Nope.
Or tuberculosis?
Nope.
No tumors or ulcers that you've had?
No.
No history of epilepsy or fainting or dizziness?
No.
And no history of hepatitis or herpes?
Nope.
No kidney disease or liver disease? Any nervous problems or psychiatric care that you've had in the past?
No.
And you're not taking any medications currently?
Not currently, no.
Do you smoke cigarettes at all?
Cigarettes? No.
No. Do you smoke cannabis at all?
Yes.
Okay. And do you drink alcohol?
On occasion.
Would you say you have a high sugar intake?
Not really.
Awesome. And you are under the care of a physician? Right?
Yeah.
Okay, perfect. And have you ever been hospitalized?
No.
Okay. Awesome. All right, so you told me that you do smoke cannabis on occasion, or take edible cannabis, and you also drink alcohol. So this puts you in an ASA 2 class category of health, and also reviewing your vitals. Your temperature was really good, your pulse and everything was really good. It was a little on the lower side for 60, but I know that you work out every day, so we'll keep an eye on that. Your blood pressure though, you are in hypertension stage 1, so we definitely should monitor that, and that's definitely something I would bring up to your doctor at your next appointment and just let her know, to keep an eye on it. But as far as the cannabis goes, it's important to know that the cannabis, it can affect the rest of your body, but it can especially affect your mouth. So it might lead to things like dry mouth really bad. And since you already are having some issues with hypertension, cannabis can actually affect your blood pressure also. So when you have to come into the dental office, that's a really good thing for us to know, just in case we have to give you anesthesia, because it can cause hypotension, and we don't want you having any sort of blood pressure issues when you're in the chair. As far as that though, there are risks associated with oral cancer, white patches in your mouth. So if you notice anything like that, definitely let us know. I'm also going to evaluate that. Do you have any questions about the association of cannabis and oral factors?
No.
So as far as alcohol goes, it is also associated with some things orally that we'll be watching for, such as bleeding gums. I know that you had a history of that. So alcohol can really enhance your bleeding factors, so we want to be really careful with that. It can also cause things like bad breath, oral cancer, like cannabis. Yes, we definitely want to be watching out for those things today. So let's get started.